Hello everyone, I'm Dr. Eno Nsima Obat. March is Colon Cancer Awareness Month, and today we're going to talk about colon cancer screening, why it matters, when to start, and the different options you have. Colon cancer is one of the most common cancers in both men and women. In the early stages, it often causes no symptoms. You can feel completely fine and still have polyps growing inside your colon. Most colon cancers start as small growths called polyps. These can slowly turn into cancer over time. Screening allows us to find and remove these polyps before they become dangerous. That means screening does not just detect cancer, it can prevent it. So, when should you start? If you're at average risk, screening should begin at age 45. You may need earlier screening if you have a family history of colon cancer, a history of colon polyps, inflammatory bowel disease, Crohn's disease, and ulcerative colitis, and certain inherited conditions. So, you may be wondering, what are the screening options? Most people think colonoscopy is the only option. That is not true. So let's go through your choices. You have the stool-based tests. They're done at home. These are non-invasive and they can be done at the privacy of your home. The FIT test, which is a short form for fecal immunochemical test, checks for hidden blood in the stool. A FIT test should be done once a year. It requires a small stool sample, no bowel prep, no sedation. If the result is positive, however, you will need a colonoscopy. The next test is a stool DNA test. This test checks for hidden blood as well as DNA changes from cancer cells. The main brand in the United States is called Cologuard, and it needs to be done every 1 to 3 years. It requires a full stool sample. It's mailed in a kit, and if positive, again, you will need a colonoscopy. So, here is an easy way to explain it. FIT tests check for blood only. Cologuard checks for blood and DNA. Now let's go into colonoscopy. This is usually done every 10 years if normal. It requires a bowel prep the day before. You are sedated during the procedure. And the advantage is that we can remove polyps immediately. It is both a screening and a prevention tool. So here's some common myths. I feel fine. I don't need to, be screened. Colon cancer has no symptoms when it's early. I don't have a family history. Most people diagnosed with colon cancer do not have a family history. I'm afraid of the PrEP. Listen, the PrEP is temporary. Colon cancer is not. So, colon cancer is one of the few cancers that we can actually prevent if proper screening. If you are 45 or older and have not been screened, please take action. You have options: the yearly FIT test, the stool DNA, like the Cologuard, and a colonoscopy every 10 years. The best test is a test that you complete. Early detection saves lives. I know you've heard that over and over again. Thank you for watching, and please share this video with somebody that you really care about. It could save their life.